Welcome to today's enriching webinar brought to you by eLotus and proudly sponsored by Evergreen Herbs. I'm your host, Donna Chow. For over 2 decades, we have been your trusted provider of high-quality continuing educational courses dedicated to elevating your knowledge and expanding skill set. With an impressive lineup of over 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education content, we remain committed to delivering the best educational experience possible. Today's class, Ashi Points for Foot Pain, Master Lessons of over 50 years, will be presented by Dr. Kai-Fong Tiu. The class will run from 9 to 1 p.m. Pacific time with a short break. Before we get started, let's ensure an interactive session by setting your chat preference to everyone. For instructor questions, please type them directly in the Q&A box. Our instructor today is the highly skilled Dr. Tiu, renowned for his specialization in treating sports injuries and musculoskeletal traumas. With over 5 decades of experience, his patients often experience immediate relief and swift recovery from pain. Today's class offers a unique experience as Dr. Tiu will deliver his teachings in Mandarin Chinese, with Tina Chen providing translation. This format mirrors the immersive experience of studying in a TCM hospital in China. Dr. Tiu is exceptionally open, eager to share his wealth of knowledge, aligning with our vision of spreading TCM to the Western world. Given his pace of speech and some hearing challenges, we kindly request your patience. Throughout the class, Dr. Tiu will generously share the essence of acupuncture, offering pearls of wisdom and practical demonstrations. Don't hesitate to ask any of your questions because there are no silly ones. The more we inquire, the more we can glean from Dr. Tiu's 50 years of wisdom. Let's embark on this enriching journey together with Dr. Tiu and Tina Chen, ready to gain invaluable insights into the art of acupuncture and elevate your practice to new heights.
Good morning, everyone. How are you today? Can you hear me? If you can, please type yes into the chat room, please. Yes, okay. Let's test Dr. Tiu's mic, see if his work. 但是可以讲一些话吗？看看你的麦克风。你们跟他打个招呼，打个招呼。看那边，在 camera 在那边。Can you guys hear Dr. Tiu? Can you please type in yes if you can? Yes, 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 they can hear. Okay. Welcome, everyone. It's a great day today. This is Dr. Tiu's last class in this series, and we're excited to have you here today. We have about over 130 people online today, and it's going to be a wonderful, great class. A lot of learning and a lot of fun. So before we start, he would like to ask how many of you are new? Please type in new into the chat room so we have an idea who's never heard of Dr. Tiu and this concept of Ashi needling and his style. New, 这些都是新的学生。这些啊，都是新的学生，这么多，你看，好多。Bunch of new students. Wow, you guys are in for a treat. You'll learn how to treat foot pain very well today. Okay, and then second question he wants to know is how many years have you been practicing? Can you type into the chat room how many years, the number of years? And if you're a student, please put in student. 24年、15年、33年、20年、13年、12年。老中医了。老中医。Yeah, he says you're 老中医 means you're an old Chinese doctor. He says congratulations, that's really good. Wonderful, we have a lot of advanced practitioners.
我50多年啊。
He said he beat you guys. He said he's 50.
65年到现在。
He's a funny guy, very humble, very, very humble and excellent practitioner. Okay, wonderful, thank you. And then, yeah, so those of you who have been practicing a long time, you know, we can all learn from each other. This is a great reunion, I think, of advanced practitioners today. So if you have any tips on how to treat foot pain, please feel free to type into the chat room so that we can all learn together, because I'm sure there's no one person who can know it all. So please do that as we have this platform so that we can learn much more than what we can just learn from Dr. Tiu. I'm sure there's a lot I can learn from you guys as well. Okay, and then the third question is, how many of you do bloodletting in your clinic? Can you put in yes into the chat room? He's curious, you know, how Americans or Caucasians are with the bloodletting. whether you feel comfortable, patients feel comfortable, because in the Chinese community, it's very common. Yes, rarely. 他就说有的说有，有的说没有，有的说没有，有的说加州不能弄那样子，就是
加州那个
很少，还
哦
是蛮少的。他说外国人还是蛮怕的，就对了。
哦，对对，
Yeah. Dr. Diao says that bloodletting is really extremely effective. And because of some laws and regulations, I would suggest that you save that as your last resort, in your magic box of protocols to use. Just save it till the end. If all other techniques fail, then you can consider doing that one. Okay, as far as I understand, in California, the board doesn't really have a very firm stance on whether it is okay or not okay to bleed. They ask us to check the health department. Is that their regulations? But I do know that in the definition of what is acupuncture, you had to use a solid filiform needle to needle the patient. Now, if we needle the patient with a solid needle, and when you extract the needle, blood comes out, that's perfectly fine. But if you're using a hollow needle, like an injection needle or like a tattoo needle, then that's not allowed. So that's my understanding. But you need to check with your board, your regulation, and then check with them. Maybe my understanding is wrong. So I don't, want you guys to say, oh yeah, in class we learned that it's fine. Check with them yourself and just see what they say, and then decide for yourself if this technique, the bloodletting, is good for you. Okay, so let's go on with today's class. Dr. Diao, with his 50 years of experience, we're so fortunate to have him with us. So the overview of today's class is going to be an introduction on his style first by me. Because after I have learned it all, I would just tell it to you in English. It's faster than one sentence in Chinese, one in English. And then we will do 4 patients demo today. We selected from a list of about 10 patients, and then we picked the best ones for today's demo. So what happened in the past was we actually had live patients here. And then sometimes we don't get to, I guess, select the most suitable one, because we just kind of could treat whatever we get that day. It makes it really difficult because some patients on the day of could have something and they don't show up. So for this class, what we decided to do was we decided to select from applicants with foot pain, and then we picked 4 different, very commonly seen ones to present to you today. So then we pre-recorded them here, and then we will go ahead and show them and then discuss and then do the question and answer. So this way, you have a good idea of how to treat these 4 common ones. The first one we have is going to be heel pain. I don't know if he has plantar fasciitis or bone spur. You guys can, he never got a firm diagnosis, but it's basically heel pain. Second patient has ankle sprain. So it's very common too. And then number 3, the patient has neuropathy of the foot due to diabetes. That's what she came in for. But there's a little twist of surprise for that patient. So I won't tell you what it is. You'll see when we see it. And the 4th one is also an ankle problem, but this one is also very commonly seen where, there's re-injury, and then the patient twists the ankle very frequently after not healing it the first time completely. So then it doesn't really hurt, but there is always a certain angle in which it will hurt. So then we see how Dr. Diao treats that kind of ankle problem. So these are the 4 patients we have prepared for you today. So before we get into that, I'll go over the introduction of his technique. So here, this slide is just to tell you that in the world of Chinese medicine, there's so many styles. And, we have been in business for so long, running Evergreen and also helping with the Lotus, selecting some of the Chinese speakers. We've come across really good practitioners, all different fields. So it's an honor to have them speak with us, because every practitioner may have different agendas. They might not share the same view as, us in wanting to share all their knowledge. But Dr. Diao definitely is one of them. And in his, I don't know, he's 80 something years old. Not very polite to ask, but I think he's 83. That he wants to pass down this information to you and for you to learn it well, and then to pass on to the next generation of practitioners. That is his sincere hope that he tells me to share with you. So next slide. So Dr. Dell says he learned from many different teachers in China. Just before we got started with class, what I asked him was, so where are you from originally? And he told me that he's from Guangzhou, China. And he actually graduated as the first class of graduate from the Guangzhou TCM hospital, TCM college, I'm sorry. So before, it's the first generation of graduate. He was like, he said 22 or 23 at the time. And that was around 1960 something. And he said when he graduated, it was 1965. And that was when Cultural Revolution hit. So he said that he got out of China as soon as he could because, he said, I probably would have died in the Cultural Revolution. So he moved to Hong Kong. And when he stayed in Hong Kong, he was practicing in Hong Kong. And then when China reopened in 1978, he then went into China to visit different doctors, learn from different doctors. And then also he had an association in Hong Kong, Chinese Medicine Association. So he was able to invite a lot of speakers to come. And at the time, he said it's very easy because almost everyone wants to get out of China and see what the world is like outside. So many of the very capable practitioners were invited by him and his association to teach. And that's how he learned so many different styles from 1965 on. And so after all the styles that he's learned from different scholars, some are PhDs, some, very esteemed scholars, etc., and some clinicians, in the villages, he said that this style that he's practicing, he feels is the most direct, most efficient, and effective technique. So he's here to share with us that technique today. I feel like when I first learned it, it's very easy. But the more I learn about it, the harder I feel it is because the hard part is not in, it's pretty simple, right? You find an Ashi point, you needle. It's kind of like trigger point acupuncture if you think about it. But it's really much more than that. If you are able to come to his clinic to intern or, if you have difficult patients you cannot treat, you can bring them along to his clinic and watch him, treat the patient. And then you can see that the hard part is in feeling where is the Ashi point. It's not exactly just what the patient says. It's a little bit more in depth than that. So we will get into some of the tips and tricks. And remember, okay, every time you have a question when you're practicing this method or during the demo, if you have any questions, most of them can be found already in the lecture notes. So from class 1 to now, I have compiled all the questions pretty much and all the tips. Some are in the question form, some are already in the answer form. So you can find whatever it is that you're wondering about, most likely in the notes already. All right, so let's continue. So first of all, the key tips in his style of needling is number 1, you need to tell the patient to identify where is the most painful spot, right? Because they need to tell you. You don't want to be palpating all over the body. So if they tell you where it is, what you want to do next is number 2 is you with your finger need to palpate along that area to find if there's any hardness or cord or nodule. Because most likely that's where the stagnation is. And it's not necessarily where the patient says is most painful. Okay. It is what you find with your finger. It could be at the same point, but it may not. Okay. Number 3 key point is when he's needling, he doesn't let go of what he found, right? Because sometimes when we just kind of find where we want a needle, we would, go get our needles and then come back and kind of remember in that general area. But he doesn't do that. You will see in his demo that he's palpating hand is always holding what the location of what he found, the nodule or the cord or the hardness. And then his needle will come directly penetrating that point. Okay, so your palpating hand, he says, is much more important than the needling hand. So keep that in mind. Number 5, in order for this treatment to be effective, the patient needs to feel the de qi sensation, which is the numbness or the swelling sensation. Basically, it's not just pain. If it's just pain, he usually says you either hit a nerve or you hit a vessel. So that's not the type of sensation we're looking for. We're looking for the chi sensation. Okay, next slide. Okay, so this is a question that one of the students asked is if you cannot find an Ashi point or not, then what do you do? Where do you needle? Then he says there has to be one. You just need to expand the area of search until you find that. All right. Next point, the needling hand is not as important as the other hand, the stabilizing hand, because especially you're needling a tendon because tendons tend to move around. And if you don't hold it in place and you didn't needle into it, it won't be as effective. Okay, very important. Number 3, people ask, what gauge needle do you use? Okay, he uses gauge 30. So it's very Chinese style, right? Japanese people practitioners use 40, 42, 44 even. That feels good, but I don't know any Chinese style practitioner, who uses that. Actually, I do, but it's not very typical. This practitioner, doctor, is from Taiwan, and he's very famous for using very thin needle just to touch the skin level or a little bit deeper to affect the fascia and then whatever's underneath. But most of the Chinese style from China, you're looking at gauge 30, 32. Master Tong, same thing, gauge 30, and then you needle 3 points to get the stronger stimulation. Okay. Next question. Wear gloves. As you palpate and pull out the needle, bleeding may occur. And whenever I've seen him pull out needle, this is not bloodletting, okay? Just regular needling. When there is bleeding following the extraction of the needle, he always says, good, because more tension will be released, and the effect will be better. And he does wear gloves too, because most of the patients he does bloodletting. Okay, number 5. Contrary to the very high level practitioner who says you always can use 3 needle or 1 needle, he says use as many needles as needed to relieve the hardness and the pain. Sometimes 1 or 2 is not enough. I have seen him use like 10 needles at one side because there is more than one area that needs to be worked on, especially chronic cases. He doesn't just use 1 or 2 needles. But I do also have learned from Dr. Lin. I don't know if you have been to his class. We had a class with him where, the patient would come in, he would diagnose the patient, and he would explain how he would treat the patient with acupuncture and herbs. And he is one teacher, Dr. Lin Bo-Xin. He says that his teacher, when he taught them, is whenever you do acupuncture, you need to select maximum 5 needles. If there is a point where one side is better than the other side, then you don't need to needle bilaterally. So it's really rather sophisticated. I remember I never heard of that before. He was talking about how, like if you want to affect the chi, you would always select Li4 on the right side. And if you want to affect the blood and you want to needle PC6, you would always do the left. So the concept like that is very advanced. And of course, he doesn't really do Ashi point needling. So he's dealing with more internal organ problems. So that's probably a totally different theory. Okay, next one. All right, so he works on one area, the primary area, to attain relief first. And then he does the secondary area. So this is 2 concepts here. One is in one location, let's say the patient has elbow pain. The Ashi point is right here. And he would needle here just to relieve the pain. And then the secondary area means after he takes the needle out, sometimes the patient will still say that area of pain is gone, but then now it's in the forearm. Then he'll work on the forearm too. So that's the secondary area in this sense, near the same location. I have seen him with patients with multiple problems on the body. They have neck pain, back pain, and also knee pain or something like that. Then he will usually tell them I'll work on one area first. And if he does have time or energy, he will work on the second area. But usually what he does is he charges not for one treatment, treating multiple areas, but rather one location at a time. So he charges according to, okay, relief of neck pain is how much. And then, the next area is how much. Okay. Number 7, the chi sensation when the needle touches the knot, you need to move it up and down to break it up. Don't just touch it. You need to penetrate it. So if this is the skin, if this is the skin, if this is the skin, this is the knot. Okay, skin, that's knot. And then you're going through, right? So what he means is don't just touch it and thinking that the knot will go away. You need to penetrate it, go through the knot. That strong of a sensation to break up. I'm thinking to myself, it's probably him wanting to break the adhesion. So the effect will be more long lasting. But, you know, what he tells us is you need to penetrate it. Okay. Number 8, when the patients are very sensitive to pain, you know, those that don't have a very high tolerance for pain, what you want to do is before you needle or bleed them, you cup them first. So when you work on the area with cupping, generally the area will, you know, become warmer, and then the body kind of would know, oh, okay, that area is going to be worked on. So there is kind of like a preparation, you know, rather than just straight on needling. And because some areas could be very painful. Okay, next one. Do we need to leave the needles in for a long time? That's another question. So he does leave it in for 30 to 40 minutes in his clinic, and he also has a infrared lamp that he puts on the patient. But he says that actually, if you can attain the dirty sensation, you really don't need to leave the needles in. You can remove it because the effect will, of course, be much better. The patient can relax on your bed and sleep, right? And then when they wake up, they feel refreshed and the pain is gone and they feel great. But in addressing just the problem, he feels like, you know, just the dirty is sufficient enough to address it. You don't have to lay them down. But he also tells me that, well, you know, patients paying a lot, so they don't feel like they're getting the money worth if you just, you know, just use a couple needles and then tell them to go home. So that's more of a psychological thing. And this is something that only senior practitioners would tell you. The you know, like, I don't know if you call this a secret or what, you know, or is it a marketing thing or what, whatever you want to call it. It's I guess patient psychology, and only when you know the teacher very well, you know, or a very straightforward teacher like this with no BS will tell you the truth, kind of like that. Because long ago when I was learning from this teacher in China, it's the same thing. I watch him prescribe formulas, and every formula he would use like 2 or 3 grams of American ginseng. And I was always wonder why, you know, because some patients, they do need the ginseng, some don't. But then finally, after a month of studying with him, I was going to leave. Then I asked him why. And then he tells me, well, to tell you the truth, because I'm very famous, most of the patients I treat are governors or famous people or rich people. When I prescribe a formula, that's only like $5 or $10. They don't feel like it's worthy or it's going to work. They need to feel like it's expensive for the formula to work. So I thought that was very interesting. I've always remembered that from, you know, that internship I had. So it's very similar to this, you know. You need to make the patient feel like they're getting their treatment worth. All right, number 10, inform the patient that unlike other acupuncture methods, which often you'll find temporary relief, but following the treatment in a few hours or, you know, in the next day, the pain would return. His style is exactly the opposite. It's really painful when you're being treated. And then afterwards, maybe it will be inflamed and more pain for a couple more hours, maybe that whole day. But then the next day, the pain will subside and it will improve gradually, better and better. You know, the pain won't rebound, basically. Okay? So that's something to explain to the patient because they might think that, oh my gosh, you made me worse, right? So this is something that you want to disclose. Very similar to us giving blood movers sometimes. I always tell my patients when I'm treating headaches and I know there's blood stasis and I'm going to give a strong blood mover, you have to tell them your pain might worsen before it becomes better because we're remodeling the inside, you know, that old blood stasis, we have to get rid of it. And when we're getting rid of it, it's kind of like remodeling. It's going to be a mess. So there might be more pain. But if that happens, cut the dose in half, but don't worry, it's not making your condition worse. It's actually making it better. So that's the same thing as this. Okay. New tip on Ashi point needling. If the location of pain cannot be needled, so one of the students asked us in class, we can needle the eye or scrotum if there's pain there. How do we needle that? So that was a good question. I didn't know the answer. And he just says, okay, you need to palpate around the area and needle there instead, okay? Don't needle into these areas that you cannot needle. That's for obvious reasons. Okay, next, does Dr. Dell use a TDP lamp? He does, because he says it's more comfortable for the patients. So exactly the same thing he says. It doesn't do very much, but it just feels better, Okay, next, does Dr. Dell use electrostim? No, he does not. He doesn't need to. He feels like the stimulation was with the gauge 30. And also, he would go up and down and then really stimulate the needle until the patient feels the dirty sensation. So he doesn't need to use any more electrostim. He also stimulates the dirty sensation further by pushing along the skin. Instead of manipulating the needle, he'll push along the skin. Okay, so you will see that in a demo as well. Okay, contraindications. When the patient is pregnant, you want to be careful on needling the back. And if they're 8 months or more pregnant, no needling. And then thoracic points. He says contraindicated. I think we had a class, it was maybe the neck pain part. We showed some patient who had thoracic and neck pain, upper back and neck pain. And then he says that, if you're not an advanced practitioner, don't do these points because you might hurt somebody. Then I asked him, how do we become an advanced practitioners if we don't practice doing it? So then he demoed and showed us how to do it. So if you don't know how to do the upper back points, you can watch that video. Okay, another question. When to bleed? When there's no obvious pain or not, then do bloodletting with the cup first. And then look for the Ashi point or the knot. So this is an answer to a question. Because sometimes when the patient tells you, the pain is like all over here, but I cannot pinpoint to one area. So, right? Then you do this first. Because otherwise you don't know where to put the needle in. He says wear disposable gloves and also use disposable cups. I don't know if you guys I think OMS and Lhasa and also the Korean company sells the disposable cups. Have you seen them before? Let me show them to you really quick. Let me get it to show you. Okay, so here is a regular cup, right? Plastic cup. And what Dr. Dell does is he sells these cups to the patients. So the patients will take this home, sterilize it themselves, and if they need to come back, they can bring their own cups. The other way is to use this. This is a disposable wet cupping cup set. So the idea is, I'm gonna get closer. Can you see that it's covering the side? So when it touches the skin, the cup never touches. The cup does not touch the patient's skin. It's the blood and the contact is all with this disposable cup. So that's also good. So either way, you can sell the patient these cups or you can just buy these disposable ones. But Dr. Dell likes to use the big cup to sell this because he lets out a lot of buzz. Sometimes, half a cup of this. So this is a little bit too small for him, for his patients, because most of the people who come to him are very severe already, Okay. And then please follow the proper bloodletting protocols in your state or in your country. But just be careful when you're, doing bloodletting. Okay, next page. So generally speaking, so people would ask, well, how much blood do you let out, right? So generally speaking, 3 to 5 holes, he would have the lancet needle. And then the lancet needle, he won't use the cap because the cap will touch the patient, right? He does the freestyle lancet bleeding. And then he would poke 3 to 5 for mild cases. And for more severe cases, 10, sometimes 15 pokes per area. So the more severe the pain, the more blood you need to let out. So let me show you the lancet pen here. And then I don't know if Myra, are you able to put the link? Because in every class, people want to know where to buy the lancet pen. Okay. So here is the lancet pen, right? Let me take it out. So originally it comes like this. I bought this on Amazon. You can buy it from the supply stores too. Is it clear? Can you guys see? Okay. So this part, right, touches the skin of the patient. Then you will click, right, for the pen, lancet pen, the needle to go in. So here's a lancet disposable needle. And then you will take this, stick it in here, and take this cap off, right? Right, and you can see the needle, right? If you're doing this with this cap, with this pen cap, and then you're bleeding the patient like this, right? Clicking and bleeding the patient. When you get to the next patient, although you're switching the needle inside, I mean the actual needle inside, this part is not sterilized, right? So what Dr. Dell does is he just doesn't even use this. He doesn't use this. He just uses this and then just does this on the patient's area where it needs to be blood led. And the pen is faster than your hand, so it's pretty much not as painful as if you use your hand. I was gonna say painless, but it's really not painless. It's painful still, but it's still much faster than what we can do with our hand manually, especially with a 3H needle. I think that hurts the most. Okay, so this slide here answers how much blood you should let out if you are, how many holes you should puncture. The next slide talks about, I think, how much blood do you actually, right? How much blood you actually need to suck out. It's in the slide, maybe not this one. Okay, I'll go over this one first and then, how much blood. When the case is severe, use a cup to bleed first, and then find the hard spot or the nodule or the cord, and then needle there. So severe patients, he would bleed first because it's pretty severe. He lets the blood out, already release a lot of tension. Then he finds the Ashi point and then needle. Okay, after you bloodlet, no shower or bath for 12 hours. You don't need to put on any ointment because it'll heal by itself. Okay, on the areas that you cannot bleed, on the areas where you cannot needle or blood, the areas you cannot needle, do bloodletting. So for example, Gao Huang, the thoracic area, finger and toes, all those places you cannot needle, you can just bloodlet. Okay, when you're treating acute pain, this is an important slide. You might want to highlight this or write this down. If you're treating acute pain, bleed first and then needle. If you're treating chronic pain, needle first and then bleed, if necessary. But if the patient is already feeling okay, you don't need to bleed anymore. So what if it's a chronic pain with acute exacerbation? What would you guys do? Can you type in the chat room? If it's a chronic pain, but then let's say, oh, they heard it again, or it, exacerbated due to weather or whatever, would you treat it as an acute pain to bleed first and then needle, or would you just treat it as a chronic pain since they've had this for 10 years? What do you think? 我问他们一个问题 就说急性的是先放血再扎针，慢性是先扎针，然后要放血再放血。那如果是一个慢性的痛症，然后现在急性发作了，这样是要先放血还是要先扎针？
先放血了，就先放血，没那么痛的时候再扎针。
Okay, so his answer is 先放血 bleed first, and when it's not that painful anymore, then needle. Okay. Next, pro tip from the August class. For acute pain, the more blood you let out, the faster the relief. You can do the blooding twice in the same area to draw out more blood. I have seen that. That was actually, wow, eye-opening experience because, wow, he just let out a lot of blood. Patient says it is better, but it's not completely better. Then he did it again, I thought, wow. Okay, and then next, bleeding will be minimal or none once the stagnated blood has come out. Okay, some people ask that in class, and I also wondered the same thing in the beginning when I was doing bloodletting, because he would do the poking, right? And then he would use the suction cup to suck out the blood. The more suction, right, you use, the more blood supposedly would come out. And then in the back of my head, and I'm thinking, wow, so is it going to stop? Is it ever going to stop? Because that's something that you don't want happening, right? When you're bloodletting a patient, is that the blood continuously come out and you don't know when it will stop. But he says that don't worry, the area, once the stagnated blood in the area has all come out, the body will know to stop. It's not going to continue where it'll fill the cup and then, spill over. No, that's going to not happen. So you don't need to worry about that. The blood will stop, the bleeding will stop, and the blood will congeal, kind of like in a little jelly form. On my Facebook, under my name, I posted every time after a class. If we had a good bloodletting demo, I would record it and post it on Facebook. You can go check out my page there, or go to the Chinese bloodletting page. I also posted there because those people do it a lot. And then he shows you how to remove the cup with the blood very effectively. So there is like an art to that, and it just needs a lot of practice. Okay, in class 3, we saw some patients with no specific area of pain. In such case, don't retain the needle. Yeah, I remember that patient. She doesn't, it's like no pinpoint Ashi point. It's just pain everywhere. So he just needle in a lot of places, and then he would just needle and take it out, needle and take it out. There's no point, I guess, to get the chi sensation because there is no Ashi point, I suppose. Okay, how long is a session of bloodletting with cup? Okay, so that's a question student asked. Well, how long do we need to leave the cup, right? So generally speaking, 5 to 10 minutes or until the blood congeals. Then you need to remove it. Don't leave it too long because the area will turn very purple, right? Okay, so here is the slide that I was going to talk about earlier is how do we control the amount of blood being sucked out? How much pump, for each cup do you use to suck the skin out? So number 1, to control the amount of bleeding, of course, number 1, the depth of your lancet poke. If you are not using this where there is an edge and the maximum depth you can go in is, I don't know, like 2 millimeters or something like that. If you're using freehand, using your hands, sometimes you might poke deeper, right? Sometimes not as deep. So that will determine how much blood will come out. And number 2, how many pokes are you using? So if you're doing 2 as opposed to 10, 2 deeper pokes as opposed to 10 shallow pokes may produce the same amount of blood coming out, but the 10 pokes will cover a bigger area. So you can decide what you need to do depending on the area of the pain, like how specific, small or bigger the area is. And number 3 is the number of pump. Okay, well, so how many times do you squeeze the pump? He said, you do it until the skin is raised and you see purpleness, or when you're sucking the skin, right, using the pump, when the skin has come to raise to about a third or a half of the cup, then you can stop. You don't need to do anymore because that would be too strong of a suction. And then number 4, the length of time. So how long do you leave the cup there? So the idea is to until the blood congeals, then you can remove the cup. And how do you know if the blood congealed or not? You can look at it and you can tell, or you can tap on it a little bit. You can see that it's kind of like jello. Then it's ready. Okay. Another student also asked this in August. What does it mean when you see bubbles in the cup, And then some people was trying to be esoteric and say, oh, that's the chi coming out. And then he says, no, those are just because the suction is not tight and air leaked in. So that's why you have bubbles. Okay. If you have any questions, we welcome all the questions. Dr. Dao is here with his 50 years of experience to answer them. I love your questions. Please put them in the Q&A section, and during the time allowed for the Q&A, we'll answer them one by one, and then we'll include it in the next class's lecture notes. Okay, so how do you bleed the extremities, the toes and the fingers? I saw him do that in the first few classes. You bleed the painful spot or the joint, actually the joint. And that, to be honest, pretty painful. Probably is, but then those patients are in so much pain that they don't mind, another session of pain if it's going to give them relief later. Okay, so you first bleed the painful area of the joint. Second, you bleed the area that's swollen. And then number 3, you let the blood flow out naturally. If it doesn't happen, you need to squeeze it to let the blood out. So sometimes the blood flow to the extremities is not as good, right? If you just push it. If you're doing the Jingwell points, yes, there'll be blood coming out. But if you're doing just like in between the joints where you're needling into, like the fascia and the joint, there's not much blood there. So in that case, you need to squeeze it out. I give you a tip that Dr. Li Chun Huang gave when she came to record her auricular acupuncture course with us, and she was talking about bloodletting. And her secret of bloodletting is this. You need to massage the area first, number 1. 2, you sterilize with alcohol. And the tip here is you use 90% alcohol. The alcohol level will determine like how much massage smoothness you can have. Basically, one of them dries out more and the other one will let you massage easier. But then that's not really the secret. The secret is, one is you need to massage, okay? And then second is when you want to continuously let the point bleed, don't use a dry cotton ball. Use a wet cotton ball. So basically with alcohol. So the more you wipe the area with a wet cotton ball, alcohol swab, the more blood will just come out. You don't even need to squeeze. But if you do want to squeeze, then you can squeeze to get even more blood out. Okay, so that's a little tip there. Next one. What does it mean when the cup looks misty with water vapors? I'm sure you have encountered that, and that is because the patient has dampness. We had a patient here one time. She was really skinny, and she had that on all her cups. And we thought, wow, this skinny patient have so much dampness. It's strange. So finally, we found out why. It's because she likes to eat like ice drinks. She never drinks anything room temperature. Everything is always cold, So that's why. Next one. Contraindications. Patients who are on blood thinners and diabetic patients, be careful. You can still bleed, but don't be too aggressive, okay? Do it in moderation and start slowly, and do it only when it's necessary. Okay, so that's all we have for the introduction. If you guys can put in your questions in the Q&A, let's answer them before we take a break. And then we will start with our first demo, okay? Let me go to the Q&A section here and ask Dr. Dale. The first question from Carol. With sensitive patients, cupping first, do you do moving cupping with oil or just put the cup on the spot to get the purple color to come up? Oh, he doesn't do moving cupping. It's just stationary because he does Ashi point acupuncture, right? So we're just treating that point only. Next one. Carol asks, with bleeding cups, if the patient has blood deficiency, do you still do it, do less, or don't do any bleeding? 问题说啊，病人如果贫血，还可以放血吗？
不可以的。那个一般现在的病人一般都不会贫血，除非他有大病的那些癌症啊，那贫血就不要放了。
Okay, so he says in general, most patients are not gonna be that weak and anemic. You know, if they just have some blood deficiency, it's fine. But if they have some major illness like cancer, so they don't have enough red blood cell or they're really anemic, okay, then don't do any bleeding. But otherwise, he says that in general, almost everybody is fine. Just slightly anemic is fine because you're not extracting that much blood. At most, you're doing half a cup of this, which is not much. Okay, next question. How many days from Karen? How many days in a row can you bleed and cup? Well, I think I know what he's going to say but I'll ask him anyway. 这个病人呢，放血啊，连续放血可以放几天？
你一天一次，你那个明天一次也可以啊，都可以啊，1到3次，3天都可以啊。
就是隔一天或隔3天。
你不隔也可以，最好是隔一天呢。
最好是隔一天。
Okay,
he says it's best to do if you need to, if you haven't treated them already. It's best to bleed every other day or every 3 days. 病人如果说痛啊，就是在那个关节里面。
关节里面。
这样的话是要放血，还是要扎针，还是要从哪里扎针？
放血扎针都有效，这个是很关键啊，很多痛在关节里面的。
对对。
你先放血也可以，扎针没那么痛。你先扎针再放血也可以，因为你扎针啊也可以了，就是你要扎到骨缝里面，扎到痛点里面。
那从哪一个角度扎进去呢？
哪一个角度，你就看他那里痛啊，你就要找啊，你要找那个骨缝里面那个痛点。
可以进去骨缝的就对。
对，很多痛都是骨缝里面的表。
在那里看到。
表哦，不在表面的。你不扎进骨缝里面是没效的。
Okay, Carol, great question. He says that there are many patients with that. The pain is inside the joint. So what he says is you can bleed first and needle, or needle first and bleed. Either way is fine, but the key point is not the order in which to do this. Is you need to get into the joint, needle into the joint. So I ask him, well, then, right, if I have elbow pain, which point am I selecting to go into the joint? Then he says, then it depends on the area, you know, wherever you think you can get into the joint, then you would needle there. Let me just ask him one more question. What if it's the elbow, let's say? 如果是手踝的话，他如果说痛是在手踝里面，手肘里面呢？你会从这里扎，还是从下面扎，还是从哪里扎？这个是经验吗？还是你？不是，
你是找痛点在那里，扎那里了。
他没有痛点，他就说在里面。
里面
还是会有吗？
在里面，但有时候他讲不出来，你就那个里面，你要问他那一个地方，这个对吗？对不对？在这里吗？在这里吗？
摸到准就对。
这样的，他没有痛点，这里你要人压他，问他是不是这里？是不是这里？是不是这里？他说是这里，那你是扎到那里，基本上扎对了。
Yeah, so I asked him, like, for take example of the elbow. Now we have 6 channels, right? And then all 6 channels can get into the joints theoretically. Which one would you choose? And he says, oh, then this is what every joint you need to palpate. Although the patient knows where is the pain, which is inside the joint, they will still have a point on the outside that would be most painful. So you just need to palpate all around the elbow very carefully and then ask the patient, where is it most painful? Here, here, or here, or here, or here. Find the spot where they feel the most painful, and then make sure you go into the joint, needle into the joint. Okay, great. Next one, Marissa says, would it sting when you use a wet cotton ball to wipe? Yes, it does sting. Yes. Next question, Dr. Marquis. If a patient has fat deposit on a finger, would you stay away from bleeding around it if the pain is in the joint near it? If patient has fat deposit on a finger. 哦，他说啊，这个病人啊，如果他有脂肪瘤，还是脂肪在这个手指头的关节上面，那里痛，关节痛，你会直接从那个脂肪的那个垫扎进去，这样没关系吗？
放血扎针都可以，先放血再扎针。
就是不用在旁边。
不用说直接那个
OK
肿的地方、痛的地方扎进去。
不是它上面有那个脂肪垫或者是脂肪的那个都没关系。
没关系，没关系。
增生。Okay, yeah, he says doesn't matter. You can either bleed or needle.
放血最好的。
Right on the fat deposit. He said it's great. This case for bloodletting is perfect. Next one, anonymous. Patient after stroke has reduced sensation on the left hand and lump in PC8 area of the hand. I bled the Jingwell point on the pericardium digit sensation to have the hand improve. Is this a technique doctor has ever used? 他说有一个病人中风了，然后左手没感觉，然后在这个手腕这个地方，他有一个肿起来的，所以他就在这个心包穴的经穴放血，然后这里就好一点。你会这样子吗？就是在远端放血，不会在
远端也可以，就反正头有痛，远端乳干式的地方都要找看看有没有痛啊，有没有结节啊。那你扎完以后就是有帮助了，就有用了。
Okay, so he says this was in the slide where he says, you know, the primary area is the area to address, which is around the P8 area, right? But the secondary area, remember I was talking about that? The secondary area are the ones that are further away that you may also find treatment relief, meaning that you can, you know, you did the Jingwell, right? It's right along the pericardium channel. So if you're bleeding here, bleeding where the problem is, or bleeding along the channel, if you find the nodules or if it is an acupuncture point that you can bleed, it will also help with the condition. Next one, would you needle and bleed a swollen ganglion on the foot around kidney 2? I'm going to save that question and answer that at the end because we want to do all the demos first. And then if you have any other foot related questions, we'll address them at the end because I was hoping to find a gout patient. I didn't. And then, you know, I was hoping to find a bunion or a ganglion patient, but I didn't. You know, sometimes you just can't find all of them that you want to demo and then have them all gather together. Okay, and then last question, how far inside the joint? Do you go inside the joint capsule? 说扎进去那个关节里面啊，到底要多深？是要在那个囊里面吗？就是关节囊里面吗？
这扎的，你一个病例都不一样啊，反正扎到有酸中那个地方就对了。
Okay, he said every joint is a little bit different and every patient is a little bit different. So it depends. But the key is you need to have the patient have that 得气 sensation. Then you've attained the treatment effect. You know, whether it's inside the capsule, outside the capsule, you know, as long as they feel that swelling and that sensation, then you're good. Okay, next question. I realize it's specific to Ashi points, but in the case of knee pain, where you might use LI11 on the opposite side as the mirror system, would you bleed LI11 for any use? Oh, that's a really great question. Very theoretical. I've never tried that, but let's see what he would say. 说啊，陈照的那个方式，就是说你如果有膝盖痛，你是扎这个手肘。那如果是不扎手肘，而是放血的话，在手肘放血，膝盖会比较好吗？你有试过吗？他在问。
这个 这个叫什么治疗啊？那个
就是那个远端疗法、平衡疗法。
那这叫什么？一下想不起来。
对，
我
易经针灸。
对对，我没经验，不好传。
Okay. Well, he's very straightforward. He says, I don't know that method and I don't have experience with it. So I have no comment whether that would be helpful or not. Maybe you can try it and let us know. Maybe in the future class. I'm curious to find out because the mechanism of needling is different than bleeding and different than moxa. So I wonder if it will be helpful. Okay, next question. For contracted tendon on the palmar aspect of the palm, looks like a guitar string. How would you needle this? OK，他说啊，这个筋啊，手上的筋啊，跟那个吉他的那个弦一样，很紧这样。那这个这样整条筋都很紧的情况下，要怎么扎？
那你跟弹簧指一样啊，你去看看这里有没有啊？这些地方，你这里放松，这里看看有没有很紧。
放那边 ，OK。
对对对，一直下去。
Yeah, so this is he says for that you're treating the tendons on the palm is all very similar. I think we had a class on that too. We had a carpal tunnel patient, so all those patients with the hand tendon problems, whatever the disease name is, you usually would look for Ashi spots and knots on the forearm. That's where you needle. You wouldn't needle into the tendon. 这里就不用扎了嘛，直接找这里。
这里扎很痛。
And I said, why don't we feel the tendon like you said? That's the Ashi point. He goes, because that's very painful,
你扎这里是，你扎这里是叫你动。
Yeah, it's effective needling the forearm and let the patient move. You don't want to go straight into because needling the palm, it is extremely painful. Patient might not come back, and then they might think, oh, more painful than my original pain. Okay, great questions, you guys. Let's take a 10 minutes break and then we'll come back with our first demo. And that first demo is Gabriel with heel pain. So we'll come back at 10:10. Thank you.
Recording stopped.